Good morning, everybody. My name's Sandy Cornett, and it's my pleasure to introduce you to our next speaker, who is speaking on outdoor classrooms, living learning labs for better health. We have with us Dr. Tammy Thompson. She's a licensed design professional, a researcher and educator with over 20 years of experience in healthcare design and innovation. As Director of Experience, Engagement, Education, and Design for Eastern Carolina University Health, she leads patient education, patient and family advisory councils, and the ECU Health Reimagined Design Lab program. Dr. Thompson serves on faculty in the College of Engineering at North Carolina A&T State University, and she is a member of the PX Journal editorial board. She is also a Culture of Health Leader, which is a national leadership development program supported by the Robert Wood Johnson Foundation. It fosters collaboration among people from all fields and professions that have an influence on people's health to build just and thriving communities. This presentation is basically Dr. Thompson's strategic initiative developed as a Culture of Health leader. Welcome, Tammy. We're glad to have you with us.
Thank you, Sandy. Can you hear me okay?
Yes. Mm-hmm.
Okay, great. Thank you all for joining. I'm excited to share my project, Outdoor Classrooms, Living Learning Labs for Better Health. I'll tell you a little bit about our program, which is very unique at ECU Health. I lead the Reimagined Design Lab, and in this lab, we essentially work with any department within our system to help them to develop new and creative solutions for problems or challenges they may face. We use design thinking as our tool to do that. It's a lot of fun, and it's great to actually facilitate this experience for people who may not have a formal design training, but have the creativity and innovative spirit to make it happen. In this situation, we actually, on the patient education team, we have a similar team and we share duties. And so we thought, why not take our own project, which is the Outdoor Classrooms project, through our Reimagined Design Lab process and follow that design process in order to develop a really great solution for our community members, patients, and families. So this is the project. Today, I plan to review with you this project as it relates to the space we're providing and how you might look at ways that you might engage your community members as well in an interactive learning environment through the patient education team. So today we're also going to identify strategies for diversifying educational offerings, and we will look at how we might propose sustainable strategies for health equity. And I'll start by this is a framework that I plan to use, just steps to how you might develop an outdoor classroom. An outdoor classroom is essentially a space where we're able to engage patients, family members, and community members in healthy practices for healthy living to improve their health and well-being, which essentially is our mission at ECU Health, to improve the health and well-being of Eastern North Carolina. So we'll follow these 11 steps to get there. Identify needs. So in the design thinking process, the first thing we really want to do is to dive in and understand the needs of the stakeholders. And we did that in a couple of ways on this project. We started by looking at our community health needs assessment. According to the Center for Disease Control and Prevention, adults who eat a healthy diet live longer and have lower risk of obesity, heart disease, type 2 diabetes, and certain cancers. So we understand that healthy eating can even help people with chronic diseases to manage these conditions. According to our 2022 Community Health and Needs Assessment for this particular county where we're focused today, we looked at the top health conditions that we're battling, and we saw that heart disease, cancer, and diabetes were the number 1, number 2, and number 6 leading cause of death, respectively, in Beaufort County, which is the primary county served by this particular site. So we looked at how we might incorporate a community garden in a space that actually is very convenient to our health system and hospital site there in Beaufort County, North Carolina. And that shows you a little bit about what we're trying to do based on the results of the community health needs assessment, our goal. So we're looking at how we might educate community members, provide free resources, health screening, free food if necessary, and then guidance for sustainable growth of food at home. We also provide nutrition education and even exercise, and I'll get into that a little bit more. So the first thing we wanted to do before assuming that we knew exactly what our community members wanted was to host a community engagement event. And through the Culture of Health Leaders program, this was highly recommended before we go and start a strategic initiative, is to actually look at the needs of the community and talk with community members to ensure that we're getting it right. So we held last year, back in July, we held this community engagement event where we mobilized on site. It was just really a green, grassy area adjacent to our wellness center, and put up tents that day, put out boxes, planter boxes. It was kind of a fun activity where we were looking at how we might ask people what fruit and vegetables they like to eat, what they wanted to see in a community garden. We had flashcards with different vegetables and English on one side, Spanish on the other side, and just some simple sticker dots. So we asked them, take this sheet of dots and go out into the lawn, find the vegetables that you like most on the flashcard, and just put a dot next to it. So we were able to let them dot vote on what they thought they would want to see. In addition to that, we held health screenings. This is actually an RV. We call it our CHIC, Community Health Improvement Coach. And it's a great way to go out and make our clinic mobile, go out into the community and conduct health screenings. So we had this on site for the community members. We gave them free plants. We had our dietitians come out with a cooking demonstration and free recipes and free samples of what they had prepared, and then other activities. We also were conducting surveys to allow them to provide feedback. And from these surveys, we actually received 52 surveys that day with 6 major questions asked, and then we analyzed those. So we asked questions like, what vegetables do you like the most? What kinds of vegetables and herbs would you like to get in the community garden? And then how do you actually prepare your vegetables? And we also asked them, can you afford to buy fruit and vegetables? And we found that almost a third of our community members that day said they could not afford to buy fresh vegetables. We asked how often they eat fresh vegetables in any given week. And what we learned was that almost half of the community members did not eat fresh vegetables every day. We also looked at how far do you have to travel to get access to fresh vegetables, and what we learned from that was more than or almost a third actually have to travel. I guess I'd say almost a fourth have to travel 5 miles or more. And so this was very helpful for us. We asked them questions like how we could, how they prepare their vegetables. And sometimes we heard, we fry them. And so it also gave us insight into wanting to provide healthy recipes for preparing vegetables and how we might address all of this. The next step into this is anticipate. And this is really where we started looking at how we might design a program that would allow us to meet those needs that we had heard about and that we had read about in the latest community health needs assessment. And so with the scope, we set out to provide not only a community garden, but a learning space where we can invite community members in to learn passively and actively about healthy practices to promote health and well-being. We wanted to make this space open to other partners to come out and share as well, and exercise space. And I apologize, I have a cold. You can probably hear it in my voice. So this was our scope, and we started to lay this out. And in what we laid out for the garden, we included planter beds in just two simple rows with a 6-foot row in between. And we thought we would diagram this out into three main spaces. One was the community garden, one was the learning space, which was the concrete pad that you probably saw, let's see, that we're actually standing on here. And then the other was an exercise space, which was the front lawn outside of the gate, where we have actually conducted yoga instruction. So in this, we have 12 raised beds. They are 4 feet by 4 feet. And it's actually, each box is 4 feet by 4 feet, but they go across three boxes in one row. So we were able to lay out these beds, and then also activity tents, the concrete pad where we could host classes and educational events, space for us to park, and then the open lawn area that we use for exercising. Okay, so then we said, okay, what are our guide rails? We actually started talking with other hospitals that have community gardens to understand what were some of the challenges they faced and what we should anticipate, and how we might start developing guidelines and policies for this, knowing that as a hospital, our primary focus is not gardening. And many of us had a lot to learn about this area. We wanted to make sure that we brought in the right expertise and that we anticipated all the major issues so that we could start partnering with teams to solve these. We set some goals, and one of the things that we wanted to do that may be somewhat different from what you might see in other community gardens hosted at a hospital is, because our patient education team leads this space, we wanted to ensure that we were including the proper education. It's not just a garden where people can come and get food, but we're teaching them how to grow their own foods at home for sustainability of having access to fresh fruit and vegetables they can afford. We're also teaching them and connecting the dots between food and health. And so that was very important to us. We license our educational content, and so we wanted to identify the proper content that we could provide to our community members related to healthy diets and healthy eating. We also wanted to secure partners to help us offer various courses. And then ultimately, our goal was to make sure that we are hitting the mark by educating patients, families, and community members, and engage in the teach back process. And that we would also have a goal that all of our food that grows and is harvested and in edible condition, that we're able to actually give it to our community members. So the next step was identify funding. I have to tell you that we did have a head start on this one because this was a grant-funded project where our seed funds did come from the Culture of Health Leaders program. But we had to also look at how do we sustain this project over time. So we looked at our operational budget and how much we might allocate. and how far we could make the seed fund, like literally it was seed funding, how far we could stretch it. And then also looking at ways that we might allow community members or invite them to donate to help sustain the cost of the project. Our location, as I mentioned, was in ECU Health Beaufort Hospital in Washington, North Carolina, where we have a wellness center, and we had a green lawn adjacent to that wellness center. So this is the location for the project. And as you see here, we just lucked up. There was already this 30 by 30 foot concrete pad adjacent to our wellness center. So we sort of built off that to continue. But we love the fact that we had some trees there for shade. And we also had an area where we could have full sunlight for the plants. And we love the fact that because it's so close to the wellness center, we could lean on the wellness center for things like, providing a break and relief from the heat or the extreme weather. By going inside the wellness center, we provide access to facilities when people need it inside the wellness center, access to water and so forth. So they have proven to be a great partner for us. Okay, the next one was seek expertise. How do we do this? We started looking in all areas. Legally, what policies did we need to write? How could we sustain through future grants even? How to develop the content. And we had our expertise in-house with dietitians, but we did not have expertise in-house when it came down to gardening. So how to connect with our cooperative extension for the state and utilize their services and partner with them. We looked at how do we communicate what we're doing to the public and make sure they are aware that we are here and continuously engaging with us. And then we also looked at, how do we design this, install the beds, and maintain it over time? What partners are necessary there? Our Plan Ops team is instrumental in helping us with what we may need in terms of heavy equipment and ensuring that we are sensitive to the utilities around the space and so forth. And then how do we document this so that we can share it and continuously improve, meet our goals? So as I mentioned, the North Carolina Cooperative Extension has been a true friend to this project because they brought us the expertise that we did not have in-house at the hospital. We were able to participate in their training sessions. They have provided us a really nice book that we can use for reference materials. We can call them out for consultations and they'll tell us when if we're seeing something and we don't know what it is or what to do. And I put phone a friend here at the bottom because literally that's what it is. If we see like holes in leaves and we're not understanding it, it's easy enough for us to snap a picture and send this over to one of our contacts at the Cooperative Extension, and they'll tell us exactly what to do. So we actually wrote into our policy that we are consulting with the Cooperative Extension to ensure that they are guiding us on any chemicals that we may need to use within the garden. We're getting that advice directly from the Cooperative Extension. They also test our soils and we engage in that once a year. And they have come on site even to help us with some demonstrations and presentations as we prepare to turn over the soil for the new season. Okay, who's on our team? Well, this is led by our patient education team. You may have seen my colleague's presentation yesterday about building an internship program for patient education, but we actually have amazing interns in patient education year-round. So we engage in the fall semester, the spring semester, and also for the summer. So we're able to engage these interns where they're working directly with the public in providing educational materials and so forth, and helping in the garden. And then in addition to that, we also have our core patient education team providing guidance and developing content. Our marketing and communications team really has been a key partner. We partner with the marketing team on site, and they are able to reach out to community partners and leverage those partnerships to, help the partners and also to help us because this is really a community effort. Uh, Plan Ops, as I mentioned, has been involved from the very beginning, excuse me, in helping with paving and helping with every step of the way as we need them. We submit a ticket, we ask for their advice, they come out and they help us as we're learning as we go. Our community health improvement team is great. They come out and they host events where they're engaging the public and again with health screenings and other ways that we can support the health and well-being of the public. We partner with volunteer services because we do allow volunteers to onboard and work within our garden space. We have wellness center partners, we have health coaches coming out, and we partner with them on a daily basis where we are checking in with the front desk. We ask them, hey, what are you hearing from your wellness center clients, people who are coming in to exercise? Are they asking questions about our space? What do they need from us? And it helps us to continuously improve. And then finally, our food and nutrition services team of dietitians come out and they engage on a regular basis with our community members in this space. So we have a really great team of both internal and external partners. Let's see. Plan on paper. So what we're looking at here is guidelines. What does this look like? We took a lot of our guidance, again, from interviewing other hospitals that have similar services and sort of learning from their lessons learned about what should be our guidelines for team members and volunteers and interns in the space and what should be guidelines for the visitors coming into the space. And so we have these signs made in English and Spanish, and we're able to just sort of make sure that everyone is on the same page in terms of what to expect. I'll give you some examples. We want to make sure that team members stay safe, and so we provide the proper PPE and facilities and services for them. In inclement weather, we are following the emergency plan of the wellness center to make sure that when the wellness center closes or posts something that we need to know about related to inclement weather, we follow the same program. So we've thought through all the details of working in the space and also coming to visit the space. Now, I failed to mention that even though this presentation is called Outdoor Classrooms, Living Learning Labs for Better Health, Outdoor Classrooms was really the name that I assigned to this project as my strategic initiative as a culture of health leader. But when we transitioned this to the ECU Health campus, we named it our well-being zone. So outdoor classrooms is the general concept for how we follow these steps to create a learning space that's engaging for community members to practice healthy habits. Specifically, ECU Health has an outdoor classroom that is called the well-being zone. So that may help you understand when you see this signage. So start small. We like to say that we expand organically, and no pun intended, but we really is as part of design thinking, we are moving and led by what our stakeholders are telling us, what they need and how their needs continue to evolve. And so when we say we expand organically, we really mean that we go and we grow in the areas where people need us the most. So we had to assess what are some of the quick wins that we've had so far in the space. We know that our wellness center clients really love the space. They love being able to come out from whether they have been in the wellness center swimming or having a class or meeting with a health coach and take home fresh vegetables all year round. Um, we love the fact that we have been able to partner with the homeless shelter across the street where we provide food for the shelter. And we're open during the hours when residents may come out and also learn about the program and take food away. What resonates most with them? They love the fact that we're open year round. This is not something that closes when it starts to get cold, but we know that it's possible to grow foods that we can eat all year round in Eastern North Carolina. And so we want to model this and demonstrate that in the garden and then share the harvest with those community members who want to come by and receive. um, what do they want and what do they need? We have adjusted our hours to their needs. We have also created special programs during the summer when we have kids out of school, where we had a story time in the garden. We were reading books about vegetables and healthy eating to little kids in the garden. We have had art and nature courses out in the education space to just help people understand how to unwind, because this is not solely about the food, but we're also looking at how we can just help promote healthy practices for their own health and well-being. And you'll see that a little later on in some of our signage. What are the best opportunities to engage? We had a really successful fall harvest last year where we were able to harvest collard greens just after the frost, and which is apparently ideal. That's something I learned last year, and share them just before Thanksgiving with community members. And so when we see opportunities to leverage holidays and special moments that are coming up in the season, we try to take advantage of that to get community members to come out and learn more. And then finally, what's stopping us? Only our own fears. And we find that anytime in the design lab something new is proposed, there are all types of things that could keep us from getting started. But what we try to keep in mind is that this is our pilot project, and we're literally planting seeds and letting them grow. Sometimes it works out, sometimes it doesn't, but we fail forward in a way that I read that FAIL is an acronym for first attempt in learning. So if there's something that's not growing well in our space, we learn and we adjust and make provisions for the next season. But it's a really fun and exciting opportunity where we are taking risks. We're doing something that we've never done in this system, but the reward really is very fulfilling for the entire community and our team. And then assess and adjust. So one of the things that we looked at was, how do we provide educational materials in this space for community members? What does that look like? And we started by sort of mapping out what type of educational content will come about. Are we using our licensed content from the third party to provide in written format? Are we educating through our health events and screenings where we have health coaches and health professionals out talking to people one-on-one about their health? Are we educating people on how to get started with healthy gardening tips and safe food handling? And really the answer is all of the above. So I'm going to show you some examples where we pulled health sheets to share. We've also pulled content from our wellness center to talk about how food is medicine. And this is our latest, that we have actually created signage that helps facilitate a self-guided educational process for our community members coming out to visit. So we actually have a chief well-being officer, and she helps our team members to keep in mind that there are so many different parts of our well-being that we should consider. And we want to encourage our community members to think about this and to think about how they can support all these areas in their lives. We have some fun interactive things. This is a very cool sign that actually is being installed today at the garden. But it's a garden map that just shows the planter beds that we have. And it allows us to then move around based on how we're planting, move around these icons to help people to know where to find certain plants. So, for example, one thing that we learned was it's a good idea to rotate our crops and not plant the same items in the same beds every season or every year. And we thought, well, how can we do that? How can we create a sign that helps people know where to find various vegetables if we have to rotate every season? And we came up with this idea of making this metal sign and having magnets that we could then rotate, but depending on where we planted crops for the particular season, and having that connection back to what people may want to eat, how to store their foods, what are the health benefits, and even scanning QR codes to watch videos and learn more about it. And so these signs are very new, and we are in the process of getting them installed where we'll have signs available to help guide people on where to find the plants they want and what are the health benefits and how to take care of each plant once they take them home. We also provide well-being tips for our community members, how to cook and how to eat on a budget with still eating healthy foods, how to make the colorful plate, just lots of really great information that we're able to share. And then finally, step 11 is just sort of a recap I wanted to include of all the steps, identifying that funding source, selecting the location, asking experts such as the cooperative extension in your state to help with learning, helping you to decide what to grow, when to plant, and how to teach the team all about gardening. Identifying team members in a professional team to help with the space, establishing guidelines and policies, hours of operation, and so forth, designing the space, starting small. We didn't plant in every single planter the first season. It was a learning opportunity for us. We learned, we changed things the next season, but we have completed a full year, 4 seasons of planting and harvesting and sharing with the public, and it's been quite rewarding. Um, assess and adjust, which we just talked about in terms of educational materials, but that could apply to anything. Assess where you are, what the needs are, and how you might make adjustments for others. And so far, we have had regular hours of operation of 9 to 12 on Wednesdays and Fridays. That's when we're open to the public. The other times we have a working day for us to just tidy up the garden, and then we just give it time to grow. Um, we do schedule regular events in the garden and invite the public to come out. We're able to distribute to them every time they come out when someone needs something. We typically will harvest for them instead of allowing them to harvest for themselves, so that we're doing it safely and that we're taking care of the plants. We have partnerships within the community, including the homeless shelter that we serve. And we offer a variety of services, not just around food, but also around health screening, around exercise, and then of course around the food, healthy eating, and how to grow different foods. So I will end here and would love to take any questions that you might have. I appreciate the opportunity to share with you today.
Thanks very much, Tammy. What a wonderful example, I think, of how to extend our services and practices out into the community and engage the community. Let me see if there's anything in the chat or. Okay, not right now. I do have a question though. Do the community members actually engage in trying to help with some of the gardening?
Yes, well, when we established our policy, we determined that It would be best to have community members on board as official volunteers if they would help with the gardening. This allows us to screen them, understand their background, and take them through an official orientation so they know how to take care of the plants and how to engage with the public. So we have done that through our volunteer services team.
Okay. One question did come up here. Did you have to add any FTE for this project?
Oh, that's a really great
Everybody
question.
talks about staffing.
So I will tell you that we have not, as 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 of today, added an FTE for this project. And the main reason is that we have our patient education internship program. So all of our interns are assigned out to this site. They're not out here every day, but twice a week they come out and they serve, and that has taken the place. Our internship program gives us the equivalent of about 2.5 FTEs through at any given point throughout the year. So that has been a tremendous help to us. In addition, we have had volunteer services partnering with us to provide helping hands. And then we also invite our community partners and our internal partners from various departments, whether it's the Wellness Center, whether it is the marketing or the community health improvement team, to help with the necessary responsibilities. Would we like an FTE? Absolutely. And we think it would be great to have an FTE, not only for this, but to also look at expanding to our other wellness centers within our system. And so we are at the point of exploring this, but we have not had one to date. Excuse me.
So after the grant money from the culture group foundation basically goes away, how are you going to sustain it in terms of financially?
Great question. So we really tried to use our grant funding wisely through the Cultural Health Leaders Program. And with that, we were able to get sort of the foundational items that we needed: the planters, the shed, equipment, the fencing, big items, big ticket items. We have seen a lot of interest in donating to this project. When people come out, our wellness center has paid memberships. So those paid members come out and they work out and they love coming by the garden to look at it, to get vegetables. And they often ask us, how can we support? And so between donations that we are looking to receive from the community members and a little bit of an operational budget for uh, for within patient education, this is how we plan to sustain it, and it's actually quite affordable. This year, this season, we are actually drawing seeds where we've done transplants in the past. We're actually planting from seeds this time. So the cost can become very low because we're reusing the soil. We are adding soil, but we have our foundation included. So from that, it's not a heavy lift in terms of budget.
Yeah. Plus it's all that community engagement again, which makes it theirs. It becomes
Yes,
part of them. So that's a wonderful, wonderful way to do it. So,
absolutely.
okay, I don't see any more questions in the chat or in the Q&A. So we really appreciate your insight into, I think, a very innovative program. We have one here at Ohio State that was our heart hospital, and they worked basically with the College of Agriculture here at Ohio State, but it was really just, it's not so much of a community garden as it is a garden that was to, again, teach and help with the heart patients in particular. So it really didn't extend itself into a community garden. So I like the idea of what you've done. So maybe I'll take some of that back to them.
Well,
So
thank you. I
again,
think our main goal was that we don't want to stop at simply telling people to eat vegetables.
sure.
If we know for sure that some of our community members don't have the resources to gain access to the vegetables they need, So we really want to go a step further to teach them how to do it at home and then to also allow them to share in our harvest. And it's just been a wonderful experience for everyone involved. This is like one of my favorite things to do. You know, every couple of weeks I have a chance to go out and work in the garden and serve in the garden. And it's definitely one of my favorite, engaging and serving the communities.
So it's stress reduction for you also.
Yes.
Garden. Yeah, exactly. Wonderful. Well, thanks again very much for sharing such an innovative program. We appreciate it.
Thank
And then
you.
we have this next session coming up. Okay, thank you.
Thank you.